Among the broken systems is the system to care for the mentally ill. In fact, while we have corrected this problem, it used to be that psychiatrists were paid 60% of what other doctors were paid in the Medicare system. In other words, the government devalued their service by 40%, paying them only 60% of what other doctors got for the same time. How? Just wrong, just totally wrong. So in addition to that, many of these insurance systems, this thing that everybody carries, this card, does not have mental health opportunities. And our mental health opportunities are really diminished. As a matter of fact, the coverage for it is quite awful. Some of these patients get, 3 weeks rather, in an institution where they're supposed to turn their whole life around. They're given pills, but no opportunity for follow-up because they don't have that relationship, that legitimate medical home. Yeah, they've been assigned, but as I've said before, you're assigned to a classroom where all the chairs are gone. I mean, this is really not a game where when the music stops, the first one to a chair wins and everybody else is out on the street. But I think that's what a lot of the mentally ill feel like. We have very few mentally ill hospitals. And if you look at, even in the media, they'll discuss with you how difficult it is to get some of these people committed. And committed, of course, is a very ugly word, because what we're saying is we have to remove them from society. But I think that, indeed, it is important to do that because they're at a risk not just to their neighbor, but also to themselves. And somehow we have to find a means of follow-up. Nobody wants to admit that the brain is not working 100%, and yet the brain is another organ not unlike the heart or the liver or the kidneys, and when it isn't working properly, you have to take medication. Simple. But the brain, there's something in the brain that says, it can't be me. I don't really need this pill. And so we find it very difficult for a lot of the mentally ill people to take their medications. And justifiably, they have a lot of side effects. Some of them make you gain weight. Women have a hard time with that. And I have had patients who will not take their medicine because of the weight gain. And I have to find a way of juggling a little bit of weight gain with the right amount of medication. Not a very good way to live. And people get very angry at having to take their medication that, quite frankly, sometimes they can't afford. So now you have an expensive medication that makes you fat. If you're a woman, are you going to take it? Probably not. So again, you have to have a relationship with the doctor, with your family, to support you, to help you take this medication. Then we have to support these people to get them back to work so that they get to be productive members of society. And many of them can be, but we have a curtain that comes down as soon as anybody is given that diagnosis. So we have a lot of work to do to legitimately take these people from active society to a safe haven where we can make them well again and get them back into, productive work. That is, I think, a responsibility that we all have. And many times, this is just a fact, families don't want to deal with it. These people are very often alone. You see them, they're the homeless. That's the homeless. The homeless are the mentally ill. Sad but true.